Chronic hyperventilation means that you're breathing too fast. Breathing too fast causes your carbon dioxide level to drop and your whole body becomes too alkalotic. By normalizing your breathing, you can bring your carbon dioxide level back to normal and correct the pH. This simple correction in the pH has far-reaching effects in the body by restoring proper blood flow to all of the organs and stopping bronchoconstriction in the lungs. Bronchoconstriction is the thing that causes us to wheeze when there's an asthma attack. The Buteyko theory basically says that wheezing is the body's defensive response to hyperventilation. If someone breathes too fast, their carbon dioxide drops. By wheezing, the lungs hold on to carbon dioxide and try to correct the pH. We have seen over and over again in theory that if you can get somebody who is wheezing to slow down their breathing and increase their carbon dioxide, their wheezing goes away.